This crisis is not caused by inflation or some unforeseen problem in our healthcare system. It is entirely man-made, an entirely Republican-made crisis. This is a "we hit the wrong button" problem. The wrong policies were passed, and now more than 20 million Americans are facing an impending economic disaster. Frontline Republicans in swing districts are feeling enormous pressure from their constituents. Headlines say it all. Washington Post. Rank-and-file Republicans feel heat from constituents on health care. Associated Press. Swing district Republicans brace for political fallout if healthcare subsidies expire. Politico. Frontline Gapuz caught in healthcare jam. Despite this pressure, Republicans haven't acted, largely because of a leadership problem at the top. President Trump's main response has been, "Don't make it sound so bad." Meanwhile, his administration is systematically undermining the nation's public health system, firing CDC experts, appointing unqualified officials, and rolling out bizarre changes to vaccine protocols seemingly based on YouTube comments. To make matters worse, plans to eliminate more than 30,000 VA jobs have left veterans at risk. This hollowing out of public health has forced some Democratic-led states to step in. For instance, California's Governor Gavin Newsom recently hired former CDC leaders to fill the vacuum left by federal inaction. Joining California's effort is Dr. Deborah Hulla, former CDC chief medical officer. She explains that her role will focus on improving data exchange between states, preparing for pandemics, supporting laboratory testing, maintaining global public health coordination, despite the U.S. withdrawal from the WHO. Dr. Hulla emphasizes that state leadership is crucial, given the federal government's lack of direction. She hopes California can serve as a model and partner with other states to provide reliable, science-based guidance. She warns that political interference at the CDC, replacing scientists with realtors and aviation attorneys, risks permanent damage. Already, pediatric deaths from preventable diseases have occurred due to mismanagement. Her hope is that California can convene national experts, ensuring Americans have trustworthy guidance regardless of the state they live in. Meanwhile, the Trump administration continues to show evasive behavior in other arenas, such as the release of the Epstein files. Deputy Attorney General Todd Blanche minimized the issues, claiming mistakes were trivial and emphasizing the review process rather than accountability. Donald Trump, a leadership assessment. Donald Trump remains one of the most influential and controversial figures in modern American politics. His direct, confrontational communication style energizes supporters, but also deepens political polarization. Critics argue that a president's role should be unifying, particularly in crises, yet Trump's rhetoric often escalates tensions. Other concerns include relationship with facts and norms. Frequent attacks on institutions have weakened public trust. Economic policy. Tax cuts favored corporations and the wealthy, with long-term national debt concerns. Foreign policy. America First often strained alliances, creating global uncertainty. Crisis management. Inconsistent messaging during the COVID-19 pandemic delayed a coordinated response. Decision-making style. Emphasis on loyalty over expertise reduced quality advice and discouraged dissenting viewpoints. Despite criticisms, Trump remains popular among millions, highlighting real frustrations within American society. Criticism is not dismissal, it's a vital part of democratic accountability. Trump's legacy will be debated for decades, not just for his policies, but for how he reshaped political norms and public discourse. In summary, Donald Trump is neither a villain nor flawless. He is a complex political figure whose decisions, especially regarding public health and leadership, invite serious scrutiny.